The fluorescent lights hummed at 5:08 a.m. like insects trapped in glass. Natalie Hayes moved through the pediatric wing of Seattle General in Raleigh with the kind of efficiency that registered as nothing, just another nurse, competent enough, quiet enough, invisible enough to be forgotten before she left the room. Her shoes made no sound on the tile. She'd learned that in 2009 outside Tikrit, where footsteps could travel through mud and alert things that wanted to kill you. Old habits didn't die. They just changed uniforms. The crash cart needed reorganizing. Again. Someone had placed the pediatric airway kit in the wrong sequence, intubation tubes before laryngoscopes, which meant fumbling in an emergency, which meant seconds lost, which meant dead children. Natalie straightened it without being asked, her hands moving with the precision of someone who had arranged medical supplies in a 6-by-8-foot field hospital tent while mortar rounds shook the canvas. The epinephrine vials went in descending order by concentration. The 14-gauge angiocath needles aligned in a row like ammunition. She didn't think about why she was doing this. Muscle memory didn't require thought. "You're early, Hayes." The charge nurse, Patricia, stood in the doorway with a coffee cup that said "World's Okayest Mom" in fading letters. Patricia was nice in that exhausted way of people who'd been doing this job for 23 years and had stopped expecting miracles around year 4. Pediatric sensors ran high yesterday. Natalie didn't look up. "Thought I'd get ahead." "No one's asking you to come in early." Patricia's voice carried something like concern, which Natalie recognized the way other people recognize traffic lights, as a signal to proceed carefully. "You're salaried, not hourly. You know that, right?" Natalie closed the crash cart drawer. It whispered on its tracks, a sound like a rifle bolt cycling into place. She'd heard that sound at 3 a.m. in a field hospital outside San Juan Valley, Helmand Province, when a medevac bird was inbound and you had exactly 4 minutes to prep a trauma bay for someone's son who'd stepped on an IED. "I like the routine," Natalie said. Patricia left without pushing it. Most people didn't. They looked at Natalie's competence and steady hands and seemed to assume there was nothing more interesting underneath, just competence all the way down, like stacking identical boxes. They didn't notice the way she flinched at unexpected loud noises. They didn't see the faded Delta Force unit patch sewn into the jacket lining, pressed against her ribs like a secret kept too close to her heart. They didn't know that the scar on her left forearm, the one she kept hidden under long sleeves even in summer, came from a piece of shrapnel that had missed her brachial artery by half an inch. The break room was empty at 6:16 a.m. Natalie poured black coffee into a ceramic mug, no sugar, no cream, the way field rations had trained her to drink it. The antiseptic smell of the hospital didn't bother her. Bleach and isopropyl alcohol smelled like survival. She'd spent enough time in actual blood to develop a tolerance for the pretend version that hospitals used. Real blood smelled like copper and iron and fear. Hospital cleaning supplies just smelled like order. She sat alone at the table, her back to the wall, another habit from another time. Her thumb brushed against the patch through the fabric of her jacket, a small gesture of confirmation. Still there. Still secret. The patch showed a dagger wrapped in rope, embroidered in thread that had faded from silver to something closer to ash. She'd worn it on her shoulder for 12 years. She'd watched it earn things. Bronze star. Silver star. 2 purple hearts. She'd buried it when she stopped being a major and became a nurse with steady hands and no history. The coffee was hot enough to burn. She drank it anyway. The 6:16 a.m. shift briefing happened in the conference room, where Dr. Caldwell stood in front of a wall-mounted monitor displaying patient charts like a general reviewing troop positions. He was the kind of handsome that came with inherited money, pale blue eyes that had never seen actual struggle, jawline that belonged in a hospital brochure, the kind of confidence that came from 3 generations of family doctors and a father who'd made sure doors opened before he got there. His white coat was pressed. His stethoscope hung around his neck like a credential he was daring anyone to question. He was talking to Dr. Reeves, a resident in her 3rd year, brilliant on paper, terrified in person. "The Kapoor boy in 403, Reeves was saying. I was wondering if we should consider adjusting his anticonvulsant dosing. He's still having breakthrough seizures, and the current regimen. The dosing is appropriate for his weight and renal function, Caldwell said. He didn't make it sound like a correction. He made it sound like he was explaining color to someone who'd been born blind. Perhaps you should spend less time second-guessing established protocols and more time understanding why they exist. You'll learn more. Reeves nodded and wrote something in her tablet, and Natalie watched her retreat, shoulders down, confidence dismantled, the slow walk of someone who'd just learned she wasn't ready for the job everyone had told her she was qualified for. Caldwell turned to the monitor and didn't think about her again. Natalie felt something move in her chest. Not anger. Something colder than anger. Something patient. The morning rounds began at 7:53 a.m. Natalie positioned herself where she needed to be, visible enough to be useful, unremarkable enough to be forgettable. She held charts. She adjusted foot drips. She recorded vitals with the kind of precision that meant numbers that were exactly right, not roughly approximate. Her fingers moved through the work with a steadiness that came from having placed central lines in dark tents with nothing but a headlamp and the sound of distant gunfire to keep you company. Caldwell didn't look at her directly, which meant she was doing exactly what she'd trained herself to do. Competent enough to notice, invisible enough to ignore. BP 108/67, she reported on a post-op patient. Heart rate stable at 82. O2 sat 97 on room air. Caldwell glanced at the monitor, glanced at her, and moved on without acknowledgement. That was fine. Acknowledgement required seeing. She preferred not to be seen. The pediatric wing had 8 occupied beds, and Natalie had worked this unit for 14 months. 14 months of quiet shifts, careful movements, the kind of presence that made her part of the landscape instead of part of the conversation. The other nurses had stopped trying to invite her to lunch around month 3. They'd stopped wondering about her backstory somewhere between month 6 and month 8. By now, she was just the quiet one, the reliable one, the one whose patients always had the best organized med carts and the most accurate intake-output records. She was checking the foresight on a 6-year-old with post-operative pneumonia when Caldwell emerged from the conference room with a medical student trailing behind him like a smaller version of his own reflection. The student, 19, maybe 20, name tag said Morrison, was taking notes on every word. Nurse Hayes maintains excellent documentation standards, Caldwell said, not to her, but about her, the way someone might commend a piece of equipment that performed reliably. That's the kind of detail-oriented work we expect. It's the foundation of proper nursing. Not innovation. Not improvisation. Foundation. The student wrote it down. Natalie didn't acknowledge the compliment. Acknowledging it would require looking up, which would require engaging, which would require becoming a person instead of remaining a function. She adjusted the 4-drip rate and moved to the next bed. Behind her, she heard Caldwell explain something about pediatric fluid management to Morrison in the kind of voice that assumed everyone in the room was too simple to understand without his help. The morning passed like most mornings. Medications distributed. Vitals recorded. The antiseptic smell of the hospital settling into her clothes, her hair, her skin. By 10:36 a.m., she'd already organized 3 additional crash carts, restocked the medication dispensary, and rewritten the shift notes for the night nurse because they'd been organized in a way that made critical information hard to locate. That was the thing about having been trained in actual emergencies, you couldn't stop seeing everything in terms of crisis response. Every system either worked or it didn't. Every small inefficiency was a potential life. Patricia found her in the supply closet at 11:06 a.m., counting oxygen masks. You need to clock out at the actual end of your shift, Patricia said. I'm noticing you staying an extra 40 minutes most days. The morning census needs prep. The morning census will exist whether you prep it or not. Patricia's voice carried that quality again, concern that was exhausted by its own kindness. You're burning yourself out. I can see it. Natalie held an oxygen mask in her hand, small-sized, for children. The elastic was soft. The plastic was cold. I'm fine. You're not fine. You're excellent, but you're not fine. There's a difference. Patricia waited, and when Natalie didn't respond, she continued. I don't know what your history is. I've learned not to ask. But I know what it looks like when someone's working from a place of, Patricia paused, searching for the word. Obligation. Like you're trying to earn something you think you already lost. The oxygen mask was still in Natalie's hands. She looked at it instead of Patricia. I just want to do the work right. The work is done right, Patricia said. By you, every single day. That's not the problem. She left before Natalie could respond, which was the kindest thing she could have done, because responding would have required explaining things that weren't safe to explain. Things about standards that didn't apply in hospitals. Things about what happened when you lowered your standards and someone died because of it. Things about why she would never, ever trust mediocrity again. But that wasn't the worst part. The worst part was how easily she'd adapted. How simple it had been to strip away 12 years of authority and compress herself into a shape that hospitals could contain. She'd walked away from everything, the rank, the unit, the patch she still carried but never wore, and Seattle General had simply absorbed her like it absorbed every other functionary in green scrubs. She was invisible because she'd chosen to be invisible. And invisible meant safe. That was the thought moving through her mind at 3:44 p.m. when the emergency department called up to pediatrics. Not a transfer request. A warning. A child was coming in. Complications. Emergency. The kind of call that changed how you stood. The kind of call that woke things up. Natalie's hand stilled in the medication cart. Around her, the pediatric wing continued its quiet afternoon rhythm, monitors beeping their steady songs, wheels squeaking on linoleum, the soft voices of parents trying not to sound as frightened as they actually were. She could feel something shifting in her chest, muscle memory recognizing the approach of something that required everything she used to be. She didn't know it yet, but the child coming in was blind. She didn't know his father was a Delta Force colonel, still carrying dust from Tikrit in the creases of his uniform. She didn't know that Caldwell would take one look at a 7-year-old girl named Emma, not the boy, the girl, and begin the process of dismissing her case the way he dismissed everything he didn't understand. She didn't know that within 24 hours, he would humiliate her in front of a soldier she recognized as someone like herself. Someone who understood silence. Someone who understood what happened when you served something bigger than yourself and then tried to become small enough to fit back into the world. What she did know was that the invisible period was ending. The sliding doors of Seattle General's pediatric wing opened at 6:24 a.m. on a Tuesday in March, and Colonel Marcus Garrett walked through them the way soldiers walk through doors in active theater, shoulders back, eyes scanning, threat assessment automatic. Dust from Tikrit still clung to the seams of his dress uniform. He hadn't gone home. Hadn't changed. The desert hadn't released him yet. Behind him, on a stretcher pushed by 2 paramedics, 7-year-old Emma Garrett seized for the 8th time in as many hours. Her small body convulsed against the soft restraints. Her eyes, which had never seen light in her 7 years, rolled back. The seizure was silent except for the grinding of her teeth and the wet sound of her gasping for air between contractions. Natalie was restocking the crash cart when the alarm came through the overhead speaker. Pediatric admission, seizure protocol, undiagnosed neurological origin. She heard Colonel Garrett's voice before she saw him, not loud, but carrying the kind of authority that came from having made life-or-death decisions at 0300 hours with mortar fire walking closer. My daughter. She's been having seizures every 45 minutes since yesterday evening. No fever. No recent infection. She's blind since birth, and we don't know why. Dr. Caldwell materialized from the hallway like he'd been summoned, because he had been. The intercom never used his name unless it was serious. He moved with the posture of a man who'd never doubted himself, whose hands had never trembled over a patient file, whose certainty was absolute and unexamined. He was flanked immediately by a resident, a young woman named Dr. Patel who carried her tablet like armor. Emma's room smelled like hospital, that specific combination of antiseptic and something underneath it, something organic and wrong. Natalie stood outside the glass partition, watching the initial intake. She watched Caldwell's hands move over Emma's chart. Watched him order the standard anticonvulsant protocol, phenobarbital loading dose, then fosfonito in maintenance. Watched him write the order for induced hypothermia as an experimental measure, because experimental measures looked good in case reviews, because Emma's parents were desperate enough to sign consent forms written in medical language they didn't understand. But Natalie was watching Emma's seizure pattern. Watching the intervals. Watching the way the child's small fingers clenched and unclenched in a rhythm that felt almost, not quite, but almost, deliberate. The seizures were occurring every 44 to 47 minutes. That wasn't random neurological misfiring. That was something else. Something ingested or absorbed, something that had a half-life, something that built up or metabolized on a schedule. She pulled up Emma's full chart on the workstation in the nurse's station. Colonel Garrett had filled out the intake form in the clear, precise handwriting of someone trained to document everything. Emma's birth history was unremarkable. Her early childhood milestones were all present: speech, motor skills, until her sight should have developed at 3 months, and it simply hadn't. But the last 7 days were what mattered. The last 7 days, Emma had been in Raleigh with her father while he attended a command course at Fort Bragg. She'd been staying with her grandmother in an older house on Mayfield Street. Older house meant older paint. Older paint meant lead. Lead metabolized on a schedule. Lead accumulated in the body in patterns, and when it reached certain concentrations, it triggered exactly this kind of seizure presentation in children. Caldwell was making rounds when Natalie caught him in the hallway outside Emma's room. She kept her voice low, even, professional. The voice of someone reporting a finding, not questioning a superior. "Dr. Caldwell, have we run a lead toxicology screen? The seizure intervals are consistent with lead accumulation. 45-minute intervals suggest a metabolic cycle. And her vision loss from birth, lead exposure in utero would explain that. Optic nerve damage." Caldwell stopped. He turned. And his smile was the smile of a man watching something small try to speak in a room where it had no standing. Colonel Garrett stood 3 feet away, close enough to hear. Close enough to watch. "Perhaps stick to vitals, Nurse Hayes, and leave the medicine to those qualified," Caldwell said, and his voice didn't rise or harden, it stayed perfectly pleasant, perfectly reasonable, which was worse. "This is a complex neurological case, not a battlefield triage situation. Your enthusiasm is noted, but inappropriate. We have a protocol. We'll follow it." He turned back to his rounds. He didn't look at Emma's father. Didn't acknowledge the moment. Simply moved forward as though Natalie hadn't spoken, as though the suggestion had come from no one of consequence. Colonel Garrett's eyes met hers for exactly 1 second. Then he looked away. Natalie felt the tear escape before she could stop it, not because of shame, but because she saw a child dying from something that was eminently treatable if someone would just look. She took 1 measured breath, wiped the tear without breaking eye contact with Caldwell, and said quietly, "Emma deserves someone who hasn't already written her obituary." The resident, Dr. Patel, stopped walking. Caldwell's step hesitated for just a fraction of a second. Then he continued forward, his shoulders slightly more rigid, his jaw tightened in that particular way that meant he'd made a note. Mentally. The kind of note that got written down later, formally, for the record. Natalie finished her shift at noon. She went to the break room because that was what she did. That was what normal people did. She poured coffee from the pot that had been sitting there since 0600, the kind of coffee that tasted like iron and regret. She sat at the communal table where 3 other nurses, veterans of the unit, people she'd worked with for months, were scrolling through their phones. One by one, they noticed her. One by one, they picked up their cups and relocated to the far corner of the break room. The exodus was silent. Professional. No one needed to say anything. The message was clear. The message was, don't sit with her. The message was, whatever Caldwell had decided, it had already been decided. Natalie sat alone. She drank her coffee. She could hear the fluorescent lights overhead with their slight electrical hum, could hear the refrigerator cycling, could hear the rain beginning to fall against the windows outside. She could hear her own breathing. That afternoon, there was a memo on the unit board. A formal incident report printed in black ink and posted in red. Dr. Caldwell had filed a report citing Nurse N. Hayes for overstepping scope of practice, patient care interference, and boundary violations. The language was precise. It was the kind of language that sounded objective, sounded reasonable, and would be absolutely devastating to her employment record if it was ever read by a licensing board. Staff members passed the board, read the report, and looked at Natalie. Then looked away. During evening rounds, Caldwell found an opportunity. He was explaining Emma's current anticonvulsant levels to Dr. Patel, his voice clear and instructional, when he paused. Nurse Hayes seems too emotionally invested in hopeless cases, he said conversationally, as though this was a clinical observation, as though this was the kind of thing one said about colleagues without consequence. It clouds judgment. We can't have that kind of liability in the ICU. Colonel Garrett stood at the foot of Emma's bed. His hands were clenched into fists so tight his knuckles had gone white. But he said nothing. What could he say? This was a hospital. These were the rules. He had no standing here. The uniform he wore meant something on a battlefield. It meant nothing in Caldwell's domain. But that wasn't the worst part. Over the next 3 days, Caldwell moved with the precision of a chess player who had already seen 5 moves ahead. The ICU staff who had worked with Natalie, who had listened when she made suggestions, who had seen her hands move with the kind of certainty that came from experience, they were reassigned. Caldwell shuffled the schedule with administrative authority, moving them to different wings, different shifts. He replaced them with nurses who answered to him, who followed protocol without question, who understood the unspoken hierarchy. Then he changed Natalie's schedule. She'd been split between pediatric ICU and the cardiac unit. Suddenly she was full-time overnight shifts in the cardiac wing, 3 floors away from Emma's room. Suddenly her badge access to the pediatric ICU required supervisor override. When she asked why, she was told it was routine. Standard protocol review. Nothing personal. Natalie continued her shifts because that was what you did. That was what people did who understood the cost of visibility. She pulled up Emma's chart on her secure phone during her breaks, watching from a distance as Caldwell's high-dose anticonvulsants and induced hypothermia protocol failed to control the child's seizures. The intervals were still there, 44 to 47 minutes between episodes. The pattern was still screaming lead exposure. But no one was listening. One night at 2:15 a.m., during a break from the cardiac unit, Natalie walked past the pediatric ICU. She could see into Emma's room through the glass partition. Colonel Garrett sat beside his daughter's bed, his massive frame bent forward, his face in his hands. For 3 seconds, Natalie counted them without meaning to, his eyes lifted and met hers through the glass. Then a supervisor appeared and walked Natalie back to her assigned floor. That same day, Caldwell sent a memo to HR requesting a formal credentialing review. Just routine, he told the chief of staff. We need to verify qualifications, certifications, employment history. Standard procedure. But he was already drafting the termination paperwork, leaving the signature line blank. Waiting. He was patient. He could wait until the background check came back with something that would give him legal footing. There was always something. What he didn't know was that background checks on military personnel sometimes took longer than expected. What he didn't know was that certain names, certain histories, certain records were flagged at higher levels than a hospital credentialing board. What he didn't know was that 36 hours from now, a phone call would come to Seattle General asking very specific questions about why a major with a Silver Star and 2 Bronze Stars with Valor was working as a floor nurse in Raleigh. But tonight, Natalie folded her scrubs in the hospital laundry room at midnight. She creased each edge with military precision. She felt the faded unit patch sewn inside her jacket lining, Delta Force insignia from a time when she had authority, when people listened, when she didn't have to ask permission to save lives. She pressed her hand against it like it was a prayer. Like it was a secret she was about to tell whether she wanted to or not. The text came through at 02 for 7 hours, a single line on her phone's encrypted app, the one only 3 residents knew about. * Emma crashing. Caldwell's protocol failing. Not looking good. * No signature. No chance to respond. Natalie read it once, committed it to memory, and deleted it. The message was already a violation. Acknowledging it would be worse. She was restocking the cardiac wing supply closet when the phone buzzed. Third shelf, organizing 14-gauge angiocath needles by expiration date, a task that required just enough of her hands to keep her mind from spiraling about Emma Garrett's labs, Emma's blank eyes, Emma's small fingers curling into fists during the seizure. Now her hands went still. She didn't look at the phone again. She didn't need to. The words were already burning. Natalie set down the box of needles. Closed the cabinet. Moved. The hospital corridors at 0247 were a different animal than the day-shift floors. The fluorescent lights flickered at their own unpredictable rhythm, creating patches of shadow and sickly brightness. Her shoes, military-issue tactical boots, worn soft inside but still carrying the structural integrity of something built for extraction, not comfort, made no sound against the tile. 23 years of muscle memory meant she knew how to walk through a hospital without announcing herself. Heel-toe. Controlled. Like moving through a building where the enemy had night vision. The pediatric ICU was 4 wings over. 217 steps from the supply closet. She knew because she'd counted them every day for the past 2 weeks, the way a soldier memorized an exit route. The night supervisor was a woman named Patricia Chen, 64, with the kind of spine that came from 40 years of hospital work and absolutely zero tolerance for protocol violations. She was stationed at the ICU entrance, charting on a tablet, and she looked up when Natalie rounded the corner. Recognition flickered. So did the careful neutrality that meant Caldwell had left instructions. "You're not assigned here, Hayes." Not unkind. Just factual. Dr. Caldwell's orders. No unauthorized personnel during critical interventions. Natalie's breathing stayed level. The part of her that was still major, the part that had held an entire field hospital together while Hellfire missiles screamed overhead outside Tikrit, didn't even flinch. She just nodded, as if accepting the dismissal was reasonable, and then she stepped sideways like she was heading back to the main corridor. Patricia turned back to her tablet. The security monitor near the ceiling swiveled on its regular cycle, and Natalie counted the seconds, 5, 4, 3. The angle shifted away from the ICU entrance. She moved. The door was locked. Electronic card reader, the kind that logged access. Natalie had watched Caldwell's badge get swiped 17 times in the past week. The pattern was muscle memory for him: badge in, pause for the light, push. What he didn't know, what he couldn't know, was that she'd watched the nurses too. Casey Martinez, the night shift charge nurse, always held hers by the clip. Badge swung forward. Click. Push. Natalie didn't have a badge anymore. What she had was a 15-second window before Patricia's tablet updated and she realized the ICU door had opened. What she had was the sound of Emma Garrett seizing, that high, keening alarm that meant a 7-year-old's nervous system was misfiring catastrophically. What she had was the memory of a different hospital, the smell of cordite and antiseptic mixing, a child's body rigid with neurotoxin poisoning while rounds of small arms fire cratered the walls. She slipped through the door just as Patricia looked up. The ICU room was chaos with method, the kind of controlled panic that meant experienced people were doing important things very quickly. Caldwell stood at the bedside, his face flushed, his movements sharp and aggressive. 2 nurses, neither Casey, scrambled to monitor lines. Emma lay small enough to disappear into the hospital bed, her body arched backward, every muscle locked rigid. The monitors screamed, oxygen saturation 71 and dropping, heart rate 182, blood pressure climbing in the kind of dangerous elevation that meant her autonomic nervous system was going haywire. Another push. Caldwell's voice was ice. 2 milligrams midazolam and get me another EEG reading. The 4 line went in. The syringe plunged. Nothing changed except that Emma's eyes rolled back further and her hands curled into fists so tight her fingernails cut crescents into her palms. That was the detail Natalie caught first, not the vital signs, not the monitor readouts, but the specific configuration of Emma's fingers. The way they curved. The pattern of discoloration spreading from her wrists. She'd seen this. Not in a textbook. Not in a simulation. In a field hospital 11 kilometers outside Tikrit, where a 7-year-old boy had been brought in seizing, his water supply contaminated with something that made his body turn against itself, heavy metal poisoning that mimicked seizure disorder perfectly until you looked close enough to see the finger configuration, the specific rigidity of the dorsal flexion, the way the skin took on that peculiar flushed quality. He's treating the wrong thing. Natalie said it quietly, not a shout, just a statement of fact, the way she'd said things during triage when the noise was so loud you had to speak plainly just to be heard above the chaos. The room went still for exactly 1 second. Caldwell's head turned. His face was a picture of something, rage, surprise, the kind of fury that comes from being contradicted in front of witnesses. Get her out of my OR. Except it wasn't an OR, it was a pediatric ICU room, and he said it anyway because in his mind, his authority had been violated and that was the only thing that mattered. But Natalie was looking at Emma's father. Colonel Marcus Garrett stood in the corner by the window, wearing yesterday's uniform still covered in travel dust, the kind that came from being on a Chinook for 16 hours, wheels up from Kabul to Ramstein to Joint Base Andrews to Raleigh in a blur of military logistics and prayer. His hands were open at his sides. His face was grey the way a man's face goes grey when he's watching his daughter die, and there's nothing in the Delta Force handbook about this, no tactical solution, no way to breach or clear or extract your way out of a child's body turning against itself. He looked at Natalie. Please, he said. Just that. One word. The way a soldier says it when the usual chains of command don't matter anymore, when rank dissolves and all that's left is a father and a stranger and a last chance. Emma's oxygen saturation hit 69. Natalie's hands were already moving. This was muscle memory of a different kind, not the muscle memory of walking quietly through corridors, but the muscle memory of 37 hours of surgery and trauma work and field triage, the kind of memory that lives in your fingers and wrists and the part of your brain that stays calm when everything is screaming. She pulled on gloves, sharp snapping sounds like small arms fire in the sudden quiet. The room held its breath. Release the midazolam antagonist. Her voice was different now. Not asking. Not deferential. Commanding. And get me the chelation agents from storage. EDTA protocol. Pediatric dose based on weight. You have no authority, Caldwell started. I have a drowning child. Natalie moved to the 4 line, her eyes on the monitors, her hands steady as surgical lasers. 50 minutes in and her oxygen is cratering. Your protocol is causing secondary acidosis. The rigidity isn't seizure, it's heavy metal poisoning. Probably lead. Possibly mercury. The words came out flat. Clinical. The way they should. Because this wasn't about Caldwell anymore. This was about the fact that Emma's body was poisoned and her brain was dying, and Colonel Garrett was still standing in the corner with his hands open because there was nothing left for a special operation soldier to do except pray to whatever version of God listens to desperate men. Get the flumazenol, Natalie said to the closest nurse. And I need your name. Sarah. Sarah, I need you to note the time. Natalie positioned her hands over the 4-port. And I need you to watch her pupils. Emma's oxygen kept falling. 67. 65. The numbers were a countdown, a ticking clock made of her daughter's life, and Colonel Garrett made a sound like something breaking inside him. Natalie found the port with her fingers. The chelation agents were coming. She could hear Sarah moving toward the locked medication refrigerator, could hear her badge swipe and the door unlock. The minutes stretched. Emma's body remained rigid, a small child locked inside her own nervous system like a prisoner. The heart monitor beeped its irregular rhythm, 184, 186, climbing still. The first thing you learn in field medicine is that pain is data, Natalie said to no one in particular, her hands preparing the chelation protocol, her voice steady as concrete. This isn't a seizure. This is her body telling us it's poisoned. She was already reaching for the EDTA when Patricia Chen appeared in the doorway, her face uncertain, her tablet in her hands, and behind her came the sound that Natalie had been waiting for, someone's shoes moving fast, security coming, institutional response to a rule violation. But Colonel Garrett was moving too. He stepped forward, and even exhausted, even desperate, even wearing the dust of 2 continents on his uniform, he carried the unmistakable weight of command. "Stand down, Officer Chen. I'm authorizing this procedure. Sir, I need to verify." "Verify with me." His voice was quiet. It was a voice that had commanded men through ambushes and extractions and things that didn't have names in regular conversation. "My daughter is seizing. This nurse has a diagnosis. Either get out of the way or tell me why you're choosing Dr. Caldwell's orders over my child's life." The ICU room held its breath. Sarah came back with the medications, and Natalie's hands were already waiting, already knowing what came next because her fingers had done this in a field hospital under fire, under rain, under circumstances that made a pediatric ICU at Seattle General look like the safest place in the world. She found the 4-port. She drew back on the syringe. She watched the monitor. "Push going in," she said. Time 0251. Emma's oxygen was falling. There was no margin for error. The medication entered the line. And then, in the way that sometimes happens in medicine, in the way that happens when you treat the actual disease instead of the symptom you assumed, the monitors started to change. The supervisor's hand reached for Natalie's arm. She pivoted, not a violent move, just a shift of weight that made his grip slide past empty air, and walked through the ICU doors like she'd been authorized to do it her entire career. The fluorescent overhead lights cast everything in that particular shade of institutional white that made blood look darker than it was. Emma was seizing. Her small body rigid against the mat top, her blind eyes rolled back, her breathing shallow and wrong. The monitors screamed. Caldwell stood at the crash cart, hands moving with the confidence of a man who had never been questioned, pushing medications that were treating symptoms instead of cause. "Get her out." Caldwell's voice cracked like a whip. "Security. Now." Natalie was already reaching for the crash cart. She didn't look at him. She pulled open the drawer and her eyes found exactly what she needed, dimercaprol, EDTA, the chelation agent stored in the pediatric section because some resident somewhere had the sense to keep them close. Her hands moved like they had in 2019, in a field hospital outside Tikrit where the water supply had been poisoned and children had started seizing in patterns that made no sense until he recognized the pattern for what it was: heavy metal poisoning, not epilepsy, not infection, not genetic disorder. Lead. Cadmium. Mercury in the groundwater. And a 7-year-old girl presenting exactly like Emma Garrett. "This isn't a seizure disorder," Natalie said. Her voice had dropped. It sounded different now, not the deferential nurse voice from 3 days ago, but something older and harder, shaped by years of speaking over helicopter rotors and mortar fire. Neurotoxin exposure. Heavy metal poisoning. I've seen it before. Tikrit, 2019, contaminated water supply. She drew up the dimercaprol into a syringe. 5 milligrams per kilogram. For a 70-pound child, that was roughly 160 milligrams. She'd done the math automatically, the way her hands had done math in field tents with nothing but a calculator and the sound of indirect fire in the distance. "You just ended your career," Caldwell said, but his voice had changed too. It had the timbre of a man watching his carefully constructed house burn. "And possibly killed this child." "Step back," Natalie said. It wasn't a request. It was a command, the kind that made a room understand the difference between being told and being ordered. 2 security guards appeared in the doorway. She could hear their boots on the tile floor, but they stopped. Something in her posture, in the precise way she was moving, made them hesitate. She accessed Emma's full line. The needle slid home perfectly. She pushed the dimercaprol, watching the medication enter the line, and then she drew up the EDTA, another chelation agent, this one working on a slightly different mechanism, and administered that as well. Her hands were steady. They had held lives together under worse circumstances than this, with less equipment, with the smell of diesel fuel and dust and blood in the air instead of antiseptic and fluorescent hum. 90 seconds passed. Emma's rigid muscles began to ease. The spasming in her small shoulders stopped. Her breathing deepened. 180 seconds. Her oxygen saturation, which had been dropping toward 82%, climbed to 87. Then 91. The heart rate monitor shifted from the panicked scream of tachycardia to something closer to normal, 118, still high for a child in crisis, but stable. Recovering. 240 seconds. Emma took a full breath on her own. No assistance. The seizure had broken. The monitor's alarm silenced, and that silence was louder than any sound in the room, the absence of crisis, the presence of a child breathing, the simple miracle of her body relaxing into the mattress instead of fighting against its own neurochemistry. Colonel Garrett was at the wall, and his knees gave out. He slid down until he was sitting on the floor, his head in his hands, his shoulders shaking. Tears ran down his face in the way that sometimes happens to soldiers, the kind of weeping that comes only when you've been holding it together so long that letting it break feels like drowning and salvation at the same time. Caldwell stood frozen. His protocol, the experimental treatment protocol he'd begun 48 hours ago, had failed. Her off-protocol intervention had succeeded. The room knew it. The monitors knew it. Most importantly, the child knew it, because she was breathing, and her father was crying, and everything he'd built to protect his reputation had just crumbled in the time it took to push 2 syringes of medication. His recovery was swift. You could see it happen the moment he decided what to do. His spine straightened. His face hardened into something that looked almost professional, almost reasonable, almost like the face of a man in control. Remove her. Now. Security escort Nurse Hayes from the building immediately. His voice had found its anchor again. She has performed an unauthorized, off-protocol intervention that violates every hospital policy and every standard of care. I want her credentials suspended and a full investigation initiated before she leaves the grounds. The 2 security guards moved forward. One reached for her arm, and Natalie stood, letting him guide her, not resisting. The room smelled like a hospital room, the particular combination of antiseptic and the faint smell of a child's sweat, the ozone scent from the defibrillator pads they'd been preparing, the taste of metal that always seemed to coat the back of your throat when adrenaline was finally starting to metabolize. She passed the unit board where her write-up still hung in Caldwell's red pen, the words overstepping scope of practice underlined twice. She passed the break room where 3 nurses looked up from their coffee and quickly looked away again, their faces arranged in the careful neutrality of people who have decided survival means not seeing what's in front of them. She was guided to the locker room, where she changed out of her scrubs with the same precision she'd used to administer the chelation agents. Each movement deliberate. Each step the same as the one before it. But that wasn't the worst part. The worst part was the laundry room. The final indignity, the moment when a hospital decided you weren't just fired, you were erased. She was instructed to return her hospital-issued scrubs before leaving the premises, as if the fabric itself had been contaminated by her presence, as if the uniform that had seen her save a child's life just needed to be cleaned for the next person to use it, as if nothing had changed. Natalie stood alone in the hospital laundry. The industrial washers hummed in their rhythm, and the dryers rotated behind her, the smell of detergent and hot steam rising like something alive. She folded each pair of scrubs with military precision. Crease at the shoulders. Fold in half. Crease at the waist. Fold again. Stack perfectly. Her hands moved automatically, the way hands move when the mind is somewhere else, somewhere in a field hospital outside Tikrit, where a medic had taught her that the most important skill you could have was the ability to fold your emotions away so neatly that they didn't get in the way of saving lives. The faded Delta Force unit patch was sewn inside her jacket lining, over her heart. She could feel it there as she folded the scrubs, the cloth worn soft with age, the emblem barely visible, a secret that had pressed against her ribs for 3 days in this hospital and 13 years before that. The patch was from 2009. From a different life. From before she was just a nurse, before she was anything at all except someone's tool, someone's reliable equipment. She set the folded stack on the counter. The scrubs were perfect. They looked like they'd never been worn, like they were just fresh from the laundry service, ready for someone else to fill them out, someone else to care for Emma Garrett, while Dr. Caldwell decided what story he was going to tell the board about why a patient with heavy metal poisoning had improved when treated for heavy metal poisoning instead of seizures. Natalie turned and walked out of Seattle General. Behind her, in the security office on the 3rd floor, Caldwell was leaning over the shoulder of the IT director. The IT director's name was Torres. He'd been a Marine before he got out and took a job managing hospital systems, and he understood chain of command even when it was being given by someone who didn't actually have the authority to give it. "I need the footage from Emma Garrett's room deleted," Caldwell said. His voice was low, reasonable, the voice of a man asking for a small favor from someone he thought owed him. System malfunction. Data corruption. I don't care. Make it gone. Torres looked at the timestamps on the security feed. He looked at the moment when Natalie had pushed past the supervisor. He looked at the 90 seconds that had changed everything. He looked at Caldwell's face reflected in the monitor screen. "I'll take care of it, Doctor," Torres said slowly. He didn't move. The background check results arrived during a board meeting as Emma took her first steps in weeks, her small hand gripping the parallel bars in the pediatric physical therapy wing while Colonel Garrett stood silently, tears moving down his dust-covered face. In the conference room for floors above, the security director's hand trembled on the file. "Major Natalie Hayes," he read aloud, his voice hollow. The room didn't move. The security director continued, each word landing like a gavel strike. "Silver Star." A board member's pen fell. 2 bronze stars with Valor. Someone exhaled slowly. "Purple Heart." The silence stretched. Medically discharged after she held a field hospital alone for 6 hours under sustained fire. He looked up from the paper. Nobody spoke. Dr. Caldwell sat rigid in his chair, the color draining from his face like someone had pulled a plug. His mouth opened. Nothing came out. The board chairman leaned forward. "Where is Major Hayes now?" But before anyone could answer, the conference room doors opened. Colonel Marcus Garrett stood in the threshold, still in his field-worn tactical gear, dust still visible in the creases of his uniform. His jaw was set. His eyes moved to Caldwell with the precision of a targeting system. He came to attention, not parade ground posture, but the real thing, the kind that made the air pressure change. His fist came to his chest in a salute. A Delta Force salute. For a nurse. The SEAL team leader entered behind him. Breaker. Real name didn't matter, nobody had called him anything else in 17 years. He'd trained with Natalie in Tikrit, ran combat medicine drills under fire with her, watched her move through chaos the way other people moved through grocery stores. He stepped forward and spoke without waiting for permission. "I served with Major Hayes in 2009 through 2011. 3rd Battalion, 5th Marine Support Rotation. She was attached to our forward operating base outside Tikrit." His voice was quiet but it filled the room. She was field surgeon for all practical purposes. No formal rank then, but she held that position. "We took 18 casualties in a 72-hour period. 14 would be dead without her decisions." He paused. "She saved lives under fire. I watched her do it. More than once." The hospital IT specialist stood up. Marine tattoo visible on his forearm. He didn't ask permission either. He moved to the presentation screen and pulled up a file, time-stamped, dated, labeled. His fingers moved across the keyboard like he was diffusing something. Server logs show a deletion request submitted from Dr. Caldwell's computer at 0312 hours this morning. The request targeted security footage from the pediatric ICU, specifically the 0247 to 0315 timestamp. Video backup systems automatically preserve deletion requests in a parallel directory. The screen filled with code, timestamps, user IDs. The footage Dr. Caldwell attempted to delete shows Major Hayes entering Emma Garrett's room, diagnosing acute heavy metal toxicosis, and administering chelation agents while Dr. Caldwell's experimental protocol was actively failing. Emma's oxygen saturation was at 62 when Major Hayes took over. It climbed to 94 within 8 minutes. The Marine scrolled through the file. That intervention was textbook emergency medicine. The labs confirm everything. Lead levels were 127 micrograms per deciliter when the patient arrived. After Major Hayes' intervention, the follow-up draw 18 hours later showed levels dropping toward normal range. The experimental protocol would have caused permanent neurological damage. Caldwell stood up fast enough to knock his chair backward. "This is a setup." That woman manipulated, his voice cracked. His attorney, sitting beside him, grabbed his arm hard enough that Caldwell flinched. The board chairman spoke quietly. "Sit down, doctor." It wasn't a request. It was a command. Caldwell Saturday. His hands were shaking. The chairman turned to the security director. "Pull his schedule adjustments. The ones affecting Major Hayes." Files slid across the table. "Pull his communications with other board members. Any regarding her fitness." More files. The chairman's jaw moved once. "And I want to know if there's a pattern here." Torres, the IT specialist, had already pulled that too. 3 other nurses over 2 years. All of them had questioned Caldwell's protocols. All of them had challenged him on patient outcomes. One was a former Air Force pararescue specialist who'd pushed back on his treatment of a veteran patient. The veteran died, and she said his protocol contributed. She left nursing entirely. Now she worked at a veterinary clinic in Durham. 2 others had simply been reassigned so many times they'd quit. The board chairman stood. "Medical Licensing Board will receive notification by close of business today. We will also be referring this for potential criminal investigation regarding evidence tampering." He looked directly at Caldwell. "You are suspended, effective immediately, pending a formal hearing." Caldwell's attorney whispered something. Caldwell shook his head. "I want a hearing. This is a witch hunt. That woman is military. She's trained to manipulate people. She put on a show, convinced everyone." 17 people testified at the hearing we just conducted, the chairman said flatly. "You've never heard of it because we've been pulling evidence for 3 hours." Torres had compiled everything while the board reviewed Emma's case file. "Staff members documented your retaliation patterns going back 2 years. Recorded conversations where you questioned Major Hayes' mental fitness without medical basis. Schedule changes you personally initiated to isolate her from patient care. Text messages to board allies describing her as unstable. The physical evidence of you attempting to delete the most important medical footage in this hospital's recent history. Your attorney is advising you to resign before this goes to the state medical board. I suggest you listen to him." Caldwell looked at his attorney. His face had gone the color of old medical gauze. He stood, slowly, his hands still shaking. He looked at Colonel Garrett, still standing at attention near the door. For a moment something flickered across his face, recognition, maybe, of what he'd done. Of what he'd tried to do. Then he looked away. His attorney walked him out of the conference room. Nobody moved until the elevator doors closed. The silence lasted exactly 3 seconds. Then Colonel Garrett spoke. "Where is she?" His voice carried the weight of command, the weight of someone who'd lost soldiers and knew the difference between paperwork and people. The board chairman stood. I'll show you. Natalie was on the pediatric ward, moving between rooms with the same quiet efficiency that had served her in field hospitals and combat zones. Her scrubs were new, they'd given her a set after security had escorted her out. The faded Delta Force patch, sewn inside her jacket lining, pressed against her ribs like it always did. Like proof of a life she'd buried. Like a secret she'd held so long it had become part of her skeleton. Emma was in physical therapy. Her small hands gripped the parallel bars. Her father stood beside her, and when he saw Natalie entering the corridor, his posture changed. Everything about him shifted from soldier to human, the kind who understood what it meant to be saved. The board chairman followed Natalie. Major Hayes, on behalf of Seattle General Hospital, I want to formally apologize. Don't, Natalie said. Her voice had dropped an octave. Command voice. The one she'd learned to hide. Has Dr. Caldwell been suspended? Yes. We're forwarding. Good. Is the patient stable? Emma's prognosis is excellent. Full neurological recovery is likely within. Then we're finished here. Natalie didn't turn around. She could feel all of them behind her, the chairman, Colonel Garrett, Torres, Breaker. She could feel their weight, their gratitude, their recognition. She could feel the burden of being seen. But she was moving toward Emma. The child's grip on the parallel bars had tightened. Her vision had been improving in increments, not sight, but light perception, shadow, motion. She'd turned toward the sound of Natalie's footsteps. Her whole body recognized it. Colonel Garrett stepped aside without being asked. He came to attention again, a salute, this time with his hand pressed to his heart. To Natalie. To the woman who'd refused to write his daughter's obituary. Natalie took Emma's hand. The child's grip was fierce, the grip of someone who knew exactly who this was. Of someone who'd lived because of this woman's hands, this woman's knowledge, this woman's refusal to accept what everyone else had already decided. Good morning, Emma, Natalie said quietly. You came back, Emma whispered. I came back. The board chairman was still standing in the hallway, watching. He cleared his throat. Major Hayes, we'd like to offer you the position of Chief of Emergency Medicine. The full authority of the department. Natalie didn't look up from Emma's face. I have one condition. Name it. A pediatric neurology wing. Full funding. Named for this patient. The chairman didn't hesitate. Done. Within a month, Caldwell had packed his belongings into a cardboard box. His white coat was surrendered. His hospital ID was deactivated. He stood in the parking lot as staff walked past him without acknowledgement, the same exile he'd engineered for Natalie, now his own. Then he disappeared from Raleigh. A former colleague mentioned seeing him at a strip mall across town, sitting at a folding table with a banner reading supplemental insurance. Trying to flag down passers-by who avoided eye contact. Natalie felt nothing about it. Not satisfaction. Not pity. Just the quiet recognition that consequences are patient. On the opening day of the Emma Garrett Pediatric Neurology Wing, Natalie walked through the new space in her white coat. For the first time in 18 years, her rank insignia was displayed openly on her lapel. Not hidden. Not buried. Just there. Emma was there with Colonel Garrett, the child's vision partially restored through follow-up treatments, and she hugged Natalie with the fierce grip of someone who knows exactly who saved her life. Staff members who'd exiled Natalie in the break room now sought her mentorship. The unit board where her write-up had hung in red pen now displayed the wing's mission statement, written in her words, "Here, we fight for the cases others have given up on. Here, we believe in tomorrow." That evening, a young nurse approached Natalie hesitantly during rounds. How did you know to trust your judgment when everyone else said you were wrong? Natalie paused. She touched the faded unit patch now displayed openly in her office, looked through the window at Emma's wing glowing under fluorescent lights, and answered with the voice of someone who'd learned the difference between hiding and surviving. Power is not a title. Power is the ability to help. She returned to rounds, moving through her hospital now with the same quiet efficiency she'd always carried, but no longer invisible, no longer hiding. When she passed the break room, staff made space for her not out of exile but out of respect. And somewhere in Raleigh, at a folding table outside a strip mall, a man who'd tried to bury the truth was learning what it meant to be forgotten by the very institution he'd tried to control. Natalie didn't think about him. She thought about Emma's laugh. She thought about the next patient, and the one after that, and all the children whose battles were worth fighting for. Some victories don't come with applause. Some victories just come with the knowledge that you refuse to accept someone else's definition of impossible. Like and subscribe for more stories about the people who change everything when nobody's watching. And comment below, have you ever been underestimated by someone who didn't know your true value?